The white marble floor is slick with fresh arterial blood. A severed hand rests beside a shattered crystal champagne flute. The air smells of ozone, burning jet fuel, and expensive lavender aromatherapy. I am kneeling in the wreckage of the most exclusive medical fortress on Earth. My oversized scrub jacket is soaked in crimson, and a dying mercenary is staring at my hands. He does not know who I am. No one here does. They think I am just a quiet, timid nurse. They are about to find out they are trapped at 10,000 feet with a ghost. 2 hours earlier, the Aegis Alpine Retreat was a sanctuary of absolute, suffocating silence. It sits isolated on a jagged peak, a fortress of glass and white stone, accessible only by a single, heavily guarded funicular railway. This is where the world's billionaires, oligarchs, and defectors come to hide. They come to cleanse their blood of designer drugs, to recover from illicit plastic surgeries, and to breathe air that costs $10,000 a night. The air inside the retreat is artificially enriched with oxygen to combat the extreme altitude. It smells faintly of eucalyptus and sterile wealth. I walk down the pristine, sound-dampened hallway. My footsteps make no sound on the imported Italian marble. I am Alara Thorne. That is the name on my perfectly polished silver name tag. I am a night shift detox nurse. My job is to be invisible. I change intravenous bags of glutathione, Myers cocktails, and nicotinamide adenine dinucleotide for sleeping titans of industry. I wear spotless, slightly oversized white scrubs. The fabric is thick, designed to hide the shape of the body beneath. I keep my shoulders slightly hunched. I keep my eyes lowered. I speak in a soft, submissive whisper. I am the perfect, unremarkable servant in a palace of glass. The hallway stretches out before me, a tunnel of flawless white architecture. Panoramic glass windows line the eastern wall, offering a breathtaking, dizzying view of the snow-capped alpine peaks. The moon reflects off the glacial ice, casting a cold blue light into the corridor. I push my medical cart slowly. I am hyper-aware of every millimeter of the cart's movement. I know exactly how much pressure to apply to the handle to keep the wheels aligned. Suddenly, a faint squeak echoes through the silent hall. The front left caster wheel of the cart has caught a microscopic imperfection in the marble. The sound is barely audible, but in the Aegis Alpine Retreat, it might as well be a gunshot. A shadow detaches itself from the intersection ahead. Vivian Croft steps into the moonlight. She is the hospitality and compliance director of the retreat. She wears a tailored charcoal suit that costs more than a luxury sedan. Her blonde hair is pulled back into a severe, flawless chignon. Her eyes are the color of winter ice, and they are fixed entirely on the front left wheel of my cart. Vivienne does not walk. She glides. She stops 2 feet in front of me, invading my personal space with calculated precision. She looks down at the cart, then slowly raises her eyes to meet mine. I immediately drop my gaze to her collarbone, assuming the posture of a reprimanded subordinate. "Nurse Thorne," Vivienne says, her voice a perfectly modulated purr of condescension. "What was that sound?" I swallow hard, forcing a slight tremor into my voice. "I am sorry, Miss Croft," I say softly. "The wheel seems to be slightly misaligned. I will submit a maintenance request immediately." Vivienne steps closer. The scent of her bespoke jasmine perfume is overpowering. "We do not have misaligned wheels at the Aegis Retreat, Alara," she whispers. "Our clients pay millions of dollars for absolute perfection. They sign non-disclosure agreements that bind their very souls to this mountain. They expect silence. They expect a frictionless existence. A squeaking wheel shatters the illusion of paradise. It implies neglect. It implies a lack of control. Do you understand what a lack of control means in my facility?" I nod quickly, keeping my eyes downcast. "Yes, Miss Croft. I understand. It will not happen again." As I play the role of the terrified nurse, my mind is operating on a completely different frequency. I am looking at the slight flutter of Vivienne's jugular vein beneath her pale skin. I am calculating the exact amount of pounds per square inch of pressure required to collapse her trachea. I note that her center of gravity is shifted slightly to her left heel, meaning a simple sweeping kick to her right knee would shatter the joint and drop her to the marble floor in less than 1 second. I suppress the calculation. I bury it deep in the dark, locked vault of my mind. I force my hands to tremble slightly as I grip the handle of the cart. I am Alara Thorne. I am weak. I am compliant. Vivienne stares at me for another long moment, searching for any sign of defiance. Finding none, she sighs, a sound of profound disappointment. "See that you fix it, Ilara. or I will find a nurse who knows how to push a cart without disturbing the oligarchs. She turns and glides away down the corridor, her heels clicking rhythmically against the stone. I wait until she turns the corner before I let out a slow, controlled breath. I adjust my grip on the cart, slightly lifting the front left wheel off the ground, and continue my silent march toward the VIP wing. The VIP wing is secured by biometric scanners and reinforced steel doors disguised as mahogany wood. I press my thumb to the scanner. The light flashes green, and the heavy doors slide open with a soft pneumatic hiss. I enter the suite of a Russian energy magnet. The room is massive, dominated by a king-size bed covered in silk sheets. The magnate is asleep, his chest rising and falling rhythmically. Standing beside the bed is Dr. Julian Sterling. He is the retreat's lead concierge physician. He is devastatingly handsome, with perfectly styled dark hair and a perpetual tan that suggests he spends more time on yachts than in medical libraries. He wears a bespoke white coat over a designer cashmere sweater. He is currently adjusting the drip rate on an intravenous bag of high-dose vitamin C. Elara, Sterling says, not looking up from the IV pole. You are late. The hydration protocol requires strict adherence to the schedule. I apologize, Dr. Sterling, I say softly, moving to the opposite side of the bed to check the patient's vital signs monitor. I was delayed in the corridor. Sterling scoffs, a dismissive sound. Just swap the bags, and try not to disturb his aura. We are doing a deep cellular cleanse tonight. I nod and reach for the empty IV bag. As I lean over the sleeping magnate, my eyes scan his exposed chest. I freeze. My trained gaze catches something that Sterling has completely missed. Scattered across the patient's upper chest and the base of his neck is a faint, almost imperceptible rash. Tiny, pinpoint red dots. Petechiae. I look at the vital signs monitor. His oxygen saturation is hovering at 94%. It is acceptable for this altitude, but it is a 3% drop from his baseline 2 hours ago. I look at his neck. The external jugular vein is slightly distended. My mind races, processing the data with terrifying speed. Petechial rash, dropping oxygen saturation, jugular venous distension. The patient had a minor liposuction procedure in Geneva 3 days ago, before flying to the retreat. He is throwing a microembolism. A fat globule has broken loose and is currently lodging itself in the capillary beds of his lungs. It is small now, but if it propagates, he will go into acute right heart failure and stroke out before morning. I look at Dr. Sterling. He is admiring his reflection in the darkened glass of the panoramic window. I have to warn him. I have to do it without breaking my cover. Excuse me, Dr. Sterling, I say, my voice trembling with manufactured hesitation. I notice some slight petechiae on the patient's chest, and his oxygen saturation has dropped slightly. Given his recent cosmetic procedure, do you think we should perhaps consider the possibility of a microembolism? Sterling turns away from the window slowly. He looks at me as if I have just spoken to him in a dead language. He walks around the bed, invading my space just as Vivienne had done. He looks down at the patient's chest, barely glancing at the faint red dots. He laughs. It is a rich, arrogant sound. A microembolism. Really, Elara, have you been watching medical dramas on television again? I keep my eyes lowered. No, doctor. I just thought the presentation was slightly concerning. Sterling sighs, shaking his head. Elara, you have a community college nursing degree. You are here to change bags and empty bedpans. You are not here to diagnose my patients. The red marks are simply a mild histamine reaction to the high-dose vitamin infusion. The oxygen drop is a natural physiological adjustment to the deep sleep cycle at this altitude. He steps closer, his voice dropping to a condescending whisper. I practice holistic concierge medicine. I treat the entire cellular environment. I do not chase phantom blood clots based on the paranoid observations of a night nurse. Do you understand the difference between my bespoke wellness protocol and your textbook panic? I look at his hands. They are perfectly manicured, soft, unblemished. These are hands that have never cracked a chest open in a muddy ditch. These are hands that have never held a dying man's beating heart to keep him alive until the medevac arrived. Dr. Julian Sterling has zero actual trauma or emergency experience. He is a glorified spa attendant with a medical license. If this patient codes, Sterling will freeze. But I cannot tell him that. I cannot tell him that I have forgotten more about vascular medicine than he will ever learn. I cannot tell him who I really am. I nod slowly, letting my shoulders slump. You are right, Dr. Sterling. I apologize for overstepping. I will just change the bag. Good girl, Sterling says, patting me condescendingly on the shoulder. Leave the medicine to the doctors, Alara. Just focus on being quiet. He turns and walks out of the suite, his bespoke coat swishing behind him. I stand alone in the dim light of the room. I look down at the sleeping magnate. I reach into my pocket and pull out a small vial of a mild blood thinner. I discreetly inject a microdose into the IV line. It is not enough to cure the embolism, but it will keep the clot from propagating until morning, when he can be quietly transferred to a real hospital. It is a massive breach of protocol. It is highly illegal, but I will not let a man die just because his doctor is an arrogant fool. I finish swapping the IV bags and slip out of the room. The hallway is empty again. I walk toward the staff break room at the end of the corridor. The silence of the retreat is beginning to press against my eardrums. It is a heavy, unnatural silence. I enter the break room and lock the door behind me. The room is dark, illuminated only by the moonlight spilling through the floor-to-ceiling windows. I walk to the glass and press my forehead against the cold pane. I look out at the jagged, unforgiving peaks of the Alps. The isolation here is absolute. We are 10,000 feet above sea level. The only way up or down is the funicular railway, a steel cable car that clings to the side of a sheer cliff. I slowly reach up and unbutton the cuffs of my oversized scrub jacket. I roll the thick white fabric up past my elbows. I look down at my forearms in the pale moonlight. The skin is a ruined landscape of jagged, violent burn scars. The scar tissue is thick, pale, and uneven, wrapping around my arms like a grotesque map of a past life. I trace the raised edges of a particularly deep burn on my left forearm. The memory hits me like a physical blow. The suffocating heat of the jungle, the deafening roar of rotary blades, the smell of cordite, burning diesel, and vaporized blood. I was not Alara Thorne then. I was Dr. Kalen Vance. They called me the Phantom of Bogota. I was the chief medical officer for a shadow United Nations extremist task force. I operated in the darkest, most violent corners of the globe. I performed amputations under heavy cartel fire. I rebuilt shattered faces in underground bunkers, while the walls shook from artillery strikes. I was a legend in the underground tactical medicine world. And then came the crossfire, the ambush, the explosion that melted the skin off my arms and killed my entire surgical team. I survived, but the Phantom died in that jungle. I walked away from the shadow world. I erased my identity. I buried Dr. Kalen Vance and created Alara Thorne. I chose the Aegis Alpine Retreat because it was the antithesis of my past. It was cold. It was sterile. It was safe. I pull the sleeves of my scrub jacket back down, hiding the scars. I button the cuffs tightly. I take a deep, slow breath, forcing my heart rate to slow down. I practice my fluid, silent movements. I walk across the break room, my eyes automatically scanning the environment. It is a compulsion I cannot turn off. I note the structural weak points of the massive panoramic windows. I calculate the blast radius of the pressurized oxygen tanks in the adjacent storage closet. I identify the 3 fastest egress routes from the room. I am a ghost haunting a palace of glass. I am safe here. Nothing violent can touch me at 10,000 feet. I unlock the break room door and step back into the pristine hallway. The digital clock on the wall reads 2 in the morning. The retreat is in its deepest state of slumber. I walk toward the main lobby. The lobby is the crown jewel of the Aegis retreat. It is a massive, cavernous space with a vaulted ceiling and a floor made entirely of seamless white marble. Priceless Persian rugs are scattered across the stone. In the center of the room is a massive, circular fireplace surrounded by plush velvet sofas. The eastern wall is made entirely of reinforced panoramic glass, offering an unobstructed view of the helipad outside. The helipad is a circular platform of steel and concrete, jutting out over a sheer drop into the abyss. It is currently empty, dusted with a fine layer of fresh snow. I stand in the shadows near the reception desk, watching the snow fall. The silence is absolute. Then, I feel it. It is not a sound. It is a vibration. It travels up through the soles of my shoes, a deep, rhythmic tremor in the marble floor. I look at a crystal vase resting on the reception desk. The water inside the vase is rippling in tiny, concentric circles. My tactical instincts, buried under layers of forced submission, instantly flare to life. That is not an earthquake. That is a mechanical hum. I step closer to the glass, peering out into the darkness above the helipad. The snow is swirling in unnatural patterns. The hum grows louder, shifting from a vibration to a low, angry whine. It is a drone, a heavy lift, military-grade drone. Before my conscious mind can fully process the threat, the sky above the helipad erupts in a blinding flash of white-hot light. The concussive shockwave hits a fraction of a second later. It is a deafening, physical force. The sound tears through the soundproof walls of the retreat, a monstrous roar that shatters the unnatural silence. The explosion on the helipad is massive, a targeted detonation of high explosives and incendiary chemicals. A pillar of orange fire shoots into the night sky, illuminating the jagged peaks in a hellish glow. The blast wave slams into the eastern wall of the retreat. The reinforced panoramic glass, designed to withstand hurricane-force winds, bows inward under the immense pressure. A terrifying, high-pitched screech fills the lobby as the glass struggles to hold. Then, with a sound like a cracking glacier, the massive windows spiderweb with thick, jagged fissures. I am thrown backward by the force of the shockwave. I hit the marble floor hard, sliding across the polished stone. The air is instantly sucked out of the room, replaced by the bitter, freezing wind of the high Alps. The smell of ozone and burning jet fuel floods the lobby. The lights flicker violently. The pristine white illumination dies, plunging the lobby into darkness for a terrifying second. Then, the emergency generators kick in. The power grid shifts to emergency red. The cavernous lobby is bathed in a bloody, pulsing crimson light. I scramble to my feet, my ears ringing with a high-pitched whine. I look out through the spider-webbed glass. The helipad is gone. It has been reduced to a twisted, burning skeleton of steel hanging over the abyss. But the explosion is not the end. It is the catalyst. A deep, guttural groan echoes from the mountain above us. It is a sound that vibrates in the marrow of my bones. The targeted drone strike has destabilized the snowpack on the jagged peak directly above the retreat. The mountain is coming down. I watch in horrified awe as millions of tons of snow, ice, and rock detach from the peak. The avalanche roars down the slope, a terrifying white tidal wave moving at hundreds of miles an hour. The ground shakes violently, a sustained, violent earthquake. The avalanche sweeps past the eastern flank of the retreat. It misses the main structure by mere yards, but the sheer force of the displaced air hits the building like a physical blow. The retreat groans, the steel skeleton protesting under the strain. I run to the northern window, looking down toward the funicular railway. The avalanche is tearing through the valley below. I watch as the massive wall of white death slams into the steel cables and the concrete pylons of the railway. The pylons snap like dry twigs. The thick steel cables whip through the air, sparking violently before disappearing into the churning snow. The funicular is gone. The only way down the mountain has been wiped out. We are trapped at 10,000 feet, completely isolated from the rest of the world. The roaring of the avalanche slowly fades, replaced by the howling of the freezing wind tearing through the cracks in the panoramic windows. The lobby is a chaotic scene of pulsing red light and swirling snow. Suddenly, the heavy mahogany doors at the main entrance of the lobby are kicked violently off their hinges. The doors crash onto the marble floor with a deafening, splintering sound. The freezing alpine wind screams into the pristine space, bringing with it a chaotic swirl of snow and soot. A massive figure steps through the ruined doorway. It is Commander Garrick. He is a hulking, heavily scarred private military contractor. He is wearing full tactical gear, but his ceramic plates are shattered, and his uniform is shredded. He is covered in a thick layer of freezing blood and black soot. Behind him, 3 surviving private military contractors stagger into the lobby. They are dragging a man between them. It is Alexander Volkov, the secretive Eastern European oligarch and intelligence defector. He was supposed to be resting in the ultra-secure penthouse suite. He was supposed to be detoxing before a massive international tribunal testimony. Volkov is unrecognizable. His expensive silk pajamas are burned and soaked in massive amounts of arterial blood. His face is a mask of soot and torn flesh. They have just survived a close-quarters assassination attempt on the freezing helipad. The drone strike was meant for him. The pristine, hyper-luxurious lobby of the Aegis Alpine retreat is instantly desecrated. The men drag Volkov across the floor, leaving a thick, smeared trail of crimson blood on the flawless white marble and the priceless Persian rugs. Garrick drops to his knees in the center of the lobby, his massive chest heaving. He looks around the cavernous, red-lit room. His eyes are wild, filled with the frantic adrenaline of combat. "Where is the doctor?" Garrick roars, his voice echoing off the vaulted ceiling. Get me a trauma surgeon right now. He is bleeding out. The silence that follows his scream is absolute, broken only by the howling wind. From the corridor leading to the VIP wing, Dr. Julian Sterling steps into the lobby. He is still wearing his bespoke white coat. He is holding his expensive gold-plated stethoscope in his right hand. He looks like a man who has just woken up in a nightmare. Sterling takes 3 steps into the lobby and stops. He looks at the scene before him. He sees the shattered doors. He sees the hulking mercenaries covered in soot. He sees the massive pool of blood spreading across the marble floor. Then, he looks at one of the surviving mercenaries standing behind Garrick. The man turns his head toward Sterling. The lower half of the mercenary's jaw has been blown off by shrapnel. Blood is bubbling from the ruined flesh with every ragged breath. The reality of extreme, visceral violence hits Dr. Julian Sterling like a physical blow. He has spent his entire career treating hangovers, administering vitamin drips, and catering to the fragile egos of billionaires. He has never seen a gunshot wound. He has never seen a man missing half his face. Sterling's mind simply snaps. He completely dissociates. His mouth opens, but no sound comes out. His eyes glaze over, staring blankly at the bubbling blood. His fingers go slack. The expensive gold-plated stethoscope slips from his grasp. It hits the marble floor with a sharp, metallic clatter that echoes through the room. Sterling takes a slow, trembling step backward, his hands raised defensively, completely paralyzed by terror. From the opposite corridor, Vivian Croft runs into the lobby. She is still wearing her flawless charcoal suit. She stops dead in her tracks, her eyes widening in horror. But she is not looking at the dying men. She is looking at the floor. The blood. Vivian screams, her voice a hysterical, piercing shriek. The blood is on the silk rugs. You are ruining the marble. Who are these men? This is a secure facility. You cannot be in here bleeding like this. I am calling the authorities. She is completely unhinged, her bureaucratic mind unable to process the slaughterhouse that her pristine lobby has become. She continues to scream about the aesthetic damage, about the non-disclosure agreements, about the ruined thread counts. I am standing in the shadows near the reception desk. I am watching the chaos unfold. I see Garrick frantically trying to apply pressure to Volkov's neck, but the blood is slipping through his thick, clumsy fingers. I see the mercenary with the blown-off jaw swaying on his feet, seconds away from collapsing. I see Dr. Sterling backed against a pillar, trembling uncontrollably, utterly useless. I see Vivienne screaming about the rugs while men bleed to death on them. The incompetence is going to kill them all. I close my eyes. I take one deep, slow breath. I feel the freezing wind on my face. I smell the copper tang of the blood. I hear the ragged, wet breathing of the dying men. In that single breath, the timid, submissive detox nurse ceases to exist. I let Ilara Thorne die. I open my eyes. The world snaps into hyperfocus. The pulsing red emergency lights cast sharp shadows across the room. I reach up to the collar of my oversized white scrub jacket. I grip the thick fabric and pull violently. The buttons snap off, scattering across the marble floor. I strip the jacket off my shoulders and let it fall to the ground. I stand in my tight, short-sleeved undershirt. My bare arms are exposed to the freezing air. The violent, jagged burn scars from Bogota are fully visible in the bloody red light. My posture changes instantly. The hunched, submissive slouch vanishes. My spine straightens, my shoulders square. The coiled, kinetic tension of an apex predator floods my muscles. I step out of the shadows. I do not glide. I move with terrifying, predatory purpose. I walk directly toward Dr. Julian Sterling. He is still backed against the pillar, staring blankly at the carnage. I do not speak to him. I do not ask him to move. I step into his personal space, plant my hand flat against his chest, and physically shove him backward. Sterling stumbles, his bespoke shoes slipping on the marble, and crashes hard against the stone pillar. He gasps, looking at me in absolute shock. "Get out of my way," I say. My voice has dropped an octave. The soft, whispering tone of the detox nurse is gone. It is replaced by a cold, sharp, razor-edged command. It is the voice of the chief medical officer of the extremist task force. It is a voice that cuts through the chaos like a scalpel. I turn my back on the paralyzed doctor and stride toward the center of the lobby. I drop to my knees in the massive pool of blood beside the mercenary with the blown-off jaw. The man collapses onto his back, his airway filling with his own blood. He is drowning. I plunge my bare hands into the hot, pooling blood. I do not hesitate. I do not flinch. I reach into the tactical pouch on the mercenaries' shattered vest and rip out a heavy trauma dressing. I lean over the man. I jam the dressing directly into the ruined cavity of his lower jaw, packing the wound with mechanical, terrifying speed. I apply massive, crushing pressure, forcing the bleeding to stop. The man thrashes in agony, but I pin his shoulders to the floor with my knee, my movements brutally efficient. Commander Garrick stops his frantic shouting. He freezes, his hands still covered in Volkov's blood. He turns his head and stares at me. He watches my blood-soaked hands moving in a blur. I grab the loose ends of the pressure bandage. I loop them around the man's neck and the back of his skull. My fingers move with practiced, lethal precision. I pull the bandage tight and secure it. I do not tie a standard medical knot. I tie a very specific, highly classified, tactical locking knot. It is a knot designed to hold tension under extreme combat conditions. It is a knot that is only taught in the deepest, blackest underground tactical medical academies in the world. I finish the knot and snap the ends tight. The bleeding stops. The mercenary's airway is clear. I slowly lift my head and look directly at Commander Garrick. My eyes are cold, dead, and completely devoid of fear. Garrick is staring at the knot. He looks at the jagged burn scars covering my arms. He looks into my eyes. The pulsing red emergency light washes over his scarred face. His eyes widen in absolute terrified realization as he understands that the quiet, invisible detox nurse is a ghost from the covert wars. I grab the loose ends of the pressure bandage. I loop them around the man's neck and the back of his skull. My fingers move with practiced, lethal precision. I pull the bandage tight and secure it. I do not tie a standard medical knot. I tie a very specific, highly classified tactical locking knot. It is a knot designed to hold tension under extreme combat conditions. It is a knot that is only taught in the deepest, blackest, underground tactical medical academies in the world. I finish the knot and snap the ends tight. The bleeding stops. The mercenary's airway is clear. I slowly lift my head and look directly at Commander Garrick. My eyes are cold, dead, and completely devoid of fear. Garrick is staring at the knot. He looks at the jagged burn scars covering my arms. He looks into my eyes. The pulsing red emergency light washes over his scarred face. His eyes widen in absolute, terrified realization as he understands that the quiet, invisible detox nurse is a ghost from the covert wars. I do not give him time to process the shock. The luxury lobby of the Aegis Alpine Retreat is a slaughterhouse, and the clock on Alexander Volkov's life is ticking down in seconds. I stand up. The blood drips from my fingertips, pooling on the pristine white marble. I turn my attention to the rest of the room. The paralysis of the civilian staff is a luxury we can no longer afford. Vivienne is still backed against the reception desk. She is hyperventilating. Her hands are clutching the lapels of her bespoke charcoal suit. She is staring at the ruined Persian rugs, her mind trapped in a loop of bureaucratic terror. I walk toward her. My bare feet leave bloody footprints on the stone. I stop inches from her face. The scent of her expensive jasmine perfume is completely masked by the metallic stench of death. Vivienne, I say. My voice is no longer a whisper. It is a weapon. It is flat, heavy, and completely devoid of empathy. She blinks, her eyes darting to my scarred arms, then up to my face. She opens her mouth to speak, perhaps to reprimand me for my tone, perhaps to scream about the blood again. I do not let her. I lean in, my voice dropping to a terrifying guttural register. If you say one word about the rugs, I will break your jaw. Do you understand me? Vivienne swallows hard. The color drains entirely from her face. She gives a frantic, jerky nod. Good, I say. Go to the penthouse suites. Strip the beds. I need the $10,000 silk sheets. I need all of them. Bring them here immediately. We are going to tear them into pressure bandages. If you hesitate, if you stop to fold them, I will find you. Go. Vivienne turns and runs. She slips on the slick marble, recovers clumsily, and disappears down the dark corridor. I pivot toward Dr. Julian Sterling. He is still slumped against the structural pillar. His designer cashmere sweater is stained with soot from the freezing wind howling through the shattered panoramic windows. His expensive gold-plated stethoscope lies abandoned on the floor. He is shaking uncontrollably. I cross the distance between us in 3 strides. I reach down, grab the collar of his bespoke white coat, and haul him to his feet. He is taller than me, but he offers zero physical resistance. He is dead weight, consumed by panic. Dr. Sterling, I say, my voice cutting through the howling wind, look at me. His eyes are dilated, darting wildly around the room. He looks at the mercenary with the blown-off jaw. He looks at the massive pool of blood surrounding Alexander Volkov. He cannot meet my gaze. I slap him. It is not a gentle tap to wake him up. It is a calculated, violent strike across his left cheek. The sharp crack echoes over the roar of the alpine storm outside. Sterling gasps, his hand flying to his face. He finally looks at me. The arrogance that defined him an hour ago is completely gone. He is a terrified child in a war zone. You are going to help me save that man, I say, pointing to Volkov. Sterling shakes his head frantically. I cannot, he stammers. I am a concierge physician. I balance cellular hydration. I do not do trauma. I do not do surgery. He is dying, Alara. We cannot save him. My name is not Alara, I say coldly, and you are going to do exactly what I tell you, or I will leave you out on the ruined helipad to freeze. Get over there and kneel beside his head. Now. I shove him toward the center of the lobby. He stumbles, his knees hitting the blood-soaked marble. I drop down on the opposite side of Alexander Volkov. Commander Garrick is still kneeling there, his massive hands covered in blood, trying uselessly to stem the massive hemorrhage from his boss's neck. Move your hands, Commander, I order. Garrick hesitates for a fraction of a second. He looks at my eyes, sees the absolute authority burning there, and slowly pulls his hands away. The wound is catastrophic. A jagged, twisted piece of shattered titanium from the helipad structure has been driven deep into the right side of Volkov's neck by the concussive force of the drone strike. The metal is thick, tearing through muscle and fascia. I lean in close. The pulsing red emergency lights cast deep, confusing shadows, but my hands do not need light to see. My fingers trace the edge of the titanium shrapnel. The anatomy of the human neck is a dense, unforgiving highway of critical structures. The shrapnel has crushed the anterior aspect of the trachea. Volkov's chest is heaving violently, but no air is moving into his lungs. He is suffocating. Worse, a massive, pulsing stream of bright red arterial blood is welling up from beneath the titanium shard. It is not a slow venous bleed. It is a high-pressure geyser. The right common carotid artery is severed. I press my fingers deep into the wound cavity, finding the proximal end of the severed artery. I pinch it closed with my thumb and index finger, pinning it against the cervical spine. The geyser of blood slows to a sluggish crawl, but the damage is done. The carotid artery is the primary highway, delivering oxygenated blood to the brain. With it severed, the right hemisphere of Volkov's brain is currently starving. I begin the cold, mechanical calculus of survival in my head. The human brain can survive for approximately 4 minutes without oxygen before irreversible cellular death begins. Given the extreme altitude and the cold, I might have 5 minutes. The clock is already ticking. Sterling stares at the wound. He sees the crushed windpipe. He sees my fingers buried deep in the bloody cavity, holding the artery closed. He is dead, Sterling whispers, his voice trembling. His trachea is gone. His carotid is blown. You cannot fix a severed carotid artery on a marble floor. You need a vascular lab. You need synthetic grafts. You need a surgical team. Let him go. I do not look at Sterling. I keep my eyes focused on the wound. I will not let him die, I say. I look up at Garrick. Commander, I need 3 things immediately. I need the emergency trauma kit from behind the reception desk. I need a bottle of the highest proof luxury vodka from the lobby bar. And I need a light source. Garrick nods once, a sharp, military affirmative. He scrambles to his feet, his heavy boots slipping on the blood, and sprints toward the bar. I turn my attention back to Sterling. Doctor, I say, reach into your breast pocket. Give me your pen. Sterling blinks, completely bewildered. My pen. Your $5,000 Mont Blanc Platinum fountain pen, I say, my voice rising in volume. The one you used to sign the non-disclosure agreements. Give it to me right now. Sterling reaches into his bespoke white coat with trembling fingers. He pulls out the heavy, gleaming platinum pen. He holds it out to me as if it is an alien artifact. Take the cap off, I order. Unscrew the barrel. Remove the ink cartridge. I only want the hollow platinum tube. Sterling fumbles with the pen. His hands are shaking so badly he drops the cap into the pool of blood. He manages to unscrew the heavy platinum barrel and pulls out the ink cartridge. He hands the hollow metal tube to me. Garrick returns. He drops a heavy red trauma bag onto the floor beside me. He places a bottle of imported Russian vodka next to it. He clicks on a heavy tactical flashlight mounted to his shattered ceramic vest, shining the blinding white beam directly onto Volkov's neck. The stark white light reveals the true horror of the wound. The crushed cartilage of the trachea is mixed with torn muscle and pooling blood. I have to establish an airway first. If I fix the artery but he cannot breathe, he dies anyway. I reach into the trauma bag with my free hand. I pull out a number 10 surgical scalpel. The blade gleams in the tactical light. "Sterling," I say, "you are my suction machine. Take this gauze. When I cut, blood will fill the airway. You will wipe it away instantly. If you freeze, he drowns in his own blood. Do you understand?" Sterling stares at the scalpel. He looks like he is going to vomit. "I cannot," he whispers. I shift my gaze to him. It is the dead, hollow stare of the phantom. "If you do not do this, I will cut you," I say softly. Sterling whimpers, but he takes the thick pad of gauze. He nods. I position the scalpel over the cricothyroid membrane, the small indentation just below the Adam's apple. I do not have time for local anesthesia. Volkov is unconscious, hovering on the edge of the void. I press the blade down and slice horizontally through the skin and fascia. Dark venous blood instantly wells up, obscuring the surgical field. "Wipe it," I bark. Sterling jams the gauze into the wound, his hands shaking violently. He pulls it away, clearing the field for a fraction of a second. I plunge the scalpel deeper, puncturing the tough, fibrous membrane. I hear the sickening crunch of cartilage giving way. A rush of trapped air and bloody mist sprays out of the hole, hitting my face. I drop the scalpel. I reach into the trauma bag and pull out a rigid plastic endotracheal tube. I force the tube through the bloody hole in his neck, angling it down into his lungs. I grab a manual resuscitator bag from the kit, attach it to the tube, and shove it into Sterling's hands. "Squeeze it," I command. One squeeze every 5 seconds. Do not stop until I tell you. Sterling squeezes the bag. I watch Volkov's chest rise. The air is bypassing the crushed upper trachea and going straight into his lungs. The airway is secure. Now comes the impossible part. I look at the severed carotid artery. My left hand is still buried in the wound, pinching the proximal end closed. The distal end, leading up to the brain, is retracted deep into the tissue. I have to bridge the gap. I have to restore blood flow to the brain before the cellular death becomes permanent. I have no synthetic vascular grafts. I have no microscopic sutures. I have no sterile operating theater. I have a hollow platinum pen barrel and a bottle of vodka. I grab the bottle of vodka with my right hand. I bite the cork and spit it onto the floor. I pour the high-proof alcohol directly over the hollow platinum barrel, washing away the residual ink and sterilizing the metal. I pour the rest of the bottle directly into Volkov's open neck wound. Volkov's body twitches violently as the raw alcohol hits the exposed nerves, but he remains unconscious. I reach into the trauma bag and pull out a standard intravenous fluid line. I take a pair of heavy trauma shears and cut a 3-inch section of the clear, flexible plastic tubing. I slide the plastic tubing over the center of the platinum pen barrel. The fit is tight. The platinum provides the rigid structure, and the plastic tubing provides a slight flexible seal. It is a crude, improvised vascular shunt. I take a deep breath. The howling of the wind outside fades away. The pulsing red emergency lights blur into the periphery. The terrified panting of Dr. Sterling disappears. The world shrinks. It condenses down to a 2-inch square of torn flesh, shattered cartilage, and severed blood vessels. This is the zone. This is the silent, hyper-focused state of mind where the Phantom of Bogota lived. It is a place of absolute, terrifying clarity. I reach into the trauma bag and pull out 2 small, serrated hemostatic clamps. I use my right hand to apply the first clamp to the proximal end of the severed carotid artery, just below my pinching fingers. I lock the clamp tight. I slowly release my fingers. The clamp holds. The bleeding remains stopped. I dig deep into the upper cavity of the wound, searching for the distal end of the artery. It has retracted, hiding in the bloody muscle. I find it by feel. I pull it gently downward and apply the second clamp. I now have 2 clamped ends of a severed artery, separated by a 2-inch gap. I pick up the improvised platinum shunt. I bring the hollow metal tube to the proximal end of the artery. The diameter of the platinum barrel is slightly larger than the natural lumen of the vessel. I have to force it. I use a pair of surgical forceps to stretch the delicate, slippery tissue of the artery wall. I push the platinum barrel into the opening. It is a brutal, inelegant maneuver. The friction is immense. I twist the metal slightly, forcing it deeper into the vessel until the plastic tubing meets the edge of the artery. I take a heavy silk suture from the kit. I wrap it tightly around the outside of the artery, tying it down over the platinum barrel to secure the connection. I tie another tactical locking knot, pulling the silk so tight it bites into the tissue. Half the bridge is built. I shift my focus to the distal end. This is the critical connection. If this fails, the high-pressure blood flow will blow the shunt apart, and Volkov will bleed to death in seconds. I bring the other end of the platinum barrel up to the retracted distal artery. I stretch the tissue again. My hands are slick with blood. The metal is slippery. My muscles burn with the sustained, microscopic tension. I force the platinum barrel into the upper artery. I push it deep, ensuring a solid overlap. I take another silk suture and tie it down, locking the vessel against the metal. The improvised shunt is in place, a hollow platinum tube bridging the gap of a severed human artery. I pause. I look at my hands. They are perfectly steady. The tremor of the timid detox nurse is gone. The hands of the phantom are absolute. I look at Garrick. He is holding the tactical flashlight, his massive arm rigid as stone. He is watching the surgical field with the intensity of a soldier watching a bomb being defused. I look at Sterling. He is rhythmically squeezing the resuscitator bag, his eyes wide with a mixture of horror and awe. "Here we go," I whisper. I reach down and unlock the upper clamp on the distal artery. Nothing happens. I move my hand to the lower clamp on the proximal artery, the high-pressure side. I unlock the clamp and pull it away. Instantly, the hollow platinum barrel fills with bright, crimson arterial blood. The pressure hits the upper connection. The silk sutures hold. The blood rushes through the improvised bridge, bypassing the severed gap, and surges upward into the right hemisphere of Alexander Volkov's starving brain. I place my 2 fingers lightly against the plastic tubing covering the center of the platinum barrel. I feel it. Thump, thump, thump. A strong, bounding pulse. The blood flow is restored. The brain is feeding again. I let out a long, slow breath. The hyper-focused tunnel vision recedes. The sounds of the room rush back in. The howling wind, the mechanical squeak of the resuscitator bag, the distant, muffled sound of Vivienne returning with an armful of torn silk sheets. I sit back on my heels. My bare arms are coated in drying blood. My undershirt is soaked. I look down at the masterpiece of improvised violence in Volkov's neck. It is ugly. It is brutal, but it is holding. Garrick slowly lowers the tactical flashlight. He looks at the pulsing platinum tube. Then, he looks up at me. The silence stretches between us, heavy and thick. "I know that knot," Garrick says. His voice is a low, gravelly whisper. It carries over the sound of the storm. I do not reply. I begin wiping the blood from my hands with a piece of sterile gauze. "My men studied you," Garrick continues, his eyes locked onto my face. "In the underground tactical academies in Eastern Europe, they taught us about the surgeon who could rebuild a shattered pelvis in a mud trench, the surgeon who pulled a live fragmentation grenade out of a cartel boss's chest cavity. They said you died in a crossfire in Bogota." Garrick leans forward, the pulsing red light catching the deep scars on his face. "They called you the Phantom," he whispers. "Dr. Kalen Vance." Hearing the name spoken aloud in this pristine, frozen fortress feels like a physical blow. It is a ghost summoned from the grave. Dr. Julian Sterling stops squeezing the resuscitator bag. He stares at me, his jaw dropping open. The realization hits him with the force of a freight train. The quiet, submissive night nurse he had been mocking, the woman whose intelligence he had insulted, is a legendary apex predator of the medical underworld. "Keep squeezing the bag, doctor," I snap, my voice cracking like a whip. "If his oxygen saturation drops, I will hold you personally responsible." Sterling flinches and immediately resumes squeezing the bag, his eyes wide with absolute, terrified obedience. Vivienne arrives at the edge of the lobby. She drops the pile of torn $10,000 silk sheets onto the marble. She looks at the improvised surgery. She looks at the blood covering my arms. She looks at the cold, commanding posture I now hold. She shrinks back into the shadows, completely broken by the reality of the violence she has just witnessed. I look back at Garrick. "The Phantom died in the jungle, Commander," I say coldly. "My name is Ilara Thorne. I am a detox nurse, and your boss is going to live long enough to testify." We wait. The hours drag on in agonizing, freezing tension. The emergency generators hum steadily, keeping the red lights pulsing. The alpine storm rages outside. burying the shattered helipad and the ruined funicular railway under feet of fresh snow. I do not move from Volkov's side. I monitor the improvised platinum shunt constantly. I adjust the tension on the silk sutures. I manage his fluid volume using the torn silk sheets as pressure dressings for his secondary shrapnel wounds. I force Sterling to maintain the artificial respiration, rotating him out with Garrick's surviving men when his hands cramp. I rule the lobby with absolute dictatorial authority. No one speaks unless spoken to. No one moves without my permission. The luxury retreat has become a forward operating base, and I am the commanding officer. Finally, just before dawn, the howling wind begins to die down. The storm breaks. The first pale light of morning creeps over the jagged alpine peaks, filtering through the spider-webbed cracks of the panoramic windows. The red emergency lights click off as the main power grid attempts to reset, bathing the slaughterhouse in a cold gray illumination. Then, we hear it, the heavy rhythmic thumping of massive rotary blades. It is not the high-pitched whine of a civilian medical evacuation chopper. It is the deep, bone-rattling vibration of military-grade transport helicopters. I stand up. I walk to the shattered eastern window and look out over the abyss. 3 heavy, unmarked tactical helicopters rise over the edge of the cliff. They are painted matte black, devoid of any identifying insignia. They hover over the ruined helipad, their massive downwash kicking up a blinding cloud of white snow. Thick, fast ropes drop from the open side doors. Heavily armed intelligence operatives slide down the ropes, hitting the snow-covered concrete with practiced precision. They wear full tactical gear, night vision goggles pushed up on their helmets, and carry suppressed assault rifles. They move with terrifying speed, securing the perimeter of the helipad before advancing on the shattered mahogany doors of the lobby. The operatives storm into the room, their weapons raised, sweeping the corners for threats. They see the dead mercenaries. They see the blood-soaked marble. They see Garrick and his men. Clear, the lead operative shouts, lowering his rifle. A man walks through the ruined doorway behind the assault team. He is not wearing tactical gear. He is wearing a perfectly tailored dark wool overcoat. His hair is silver, neatly trimmed. His posture is rigid, projecting an aura of absolute, unquestionable authority. It is Director Roland. He is a high-ranking intelligence handler. He is a man who moves chess pieces across the global board in the darkest, most classified rooms in the world. He is the man who originally recruited me into the shadow world. He is the man who sent me to Bogota. Roland stops in the center of the lobby. He looks at the carnage. He looks at the terrified civilian staff cowering in the corners. Then, his eyes fall on Alexander Volkov. He walks slowly toward the makeshift surgical theater. He looks down at the crushed trachea. He looks at the rigid plastic tube protruding from the neck. He looks at the $5,000 platinum fountain pen barrel, bridging the severed carotid artery, held in place by tactical locking knots. Roland stares at the improvised shunt for a long time. A slow, knowing smile spreads across his face. He turns his head and looks across the lobby. I am standing near the reception desk. I have found a gold-plated sink behind the concierge counter. I have turned on the faucet. I am slowly, methodically washing the dried blood off my hands and arms. The water swirling down the drain is a deep, dark pink. Roland walks toward me. His heavy leather shoes crunch on the shattered glass covering the marble floor. He stops a few feet away, watching me scrub the blood from my burn scars. A platinum fountain pen, Roland says, his voice smooth and cultured. I must admit, Kalen, your improvisational skills have only improved with your absence. The vascular surgeons at Walter Reed would weep if they saw that. I do not look at him. I keep scrubbing my hands. The water is freezing cold. My name is Ilara Thorne, I say quietly. Roland chuckles. It is a dry, humorless sound. Ilara Thorne is a ghost, he says. A very well-constructed ghost. I will give you that. The forged background, the quiet demeanor, the oversized scrubs. It was a brilliant place to hide. The highest, most isolated peak in the world. Surrounded by people too obsessed with themselves to ever look closely at you. He steps closer, invading my space. But the vacation is over, Kalen. I turn off the faucet. I grab a pristine white towel and slowly dry my hands. I turn to face him. I am not going back, Roland, I say. My voice is flat, devoid of any emotion. Roland sighs, shaking his head. You do not have a choice. The world is burning, Kalen. The shadow wars are escalating. We are losing operators in the field because we do not have anyone who can keep them alive in the dirt. We need the Phantom. Your country needs you. I look into his eyes. I see the cold calculation there. I see the man who views human lives as expendable assets. I step toward him. I do not flinch. I do not break eye contact. The Phantom died in a cartel crossfire in Bogota, I whisper. She died while you sat in an air-conditioned room in Langley and listened to my surgical team scream over the radio. She burned to death in that jungle. I drop the blood-stained towel onto the floor at his feet. You are looking at a night shift detox nurse, I say, and my shift is over. Roland stares at me. He sees the absolute, unbreakable resolve in my eyes. He knows he cannot force me. He knows that if he tries to put me on that helicopter against my will, I will dismantle his assault team before they can unholster their weapons. He slowly nods. He accepts the defeat, for now. Very well, Nurse Thorne, Roland says, his voice dripping with condescension. Enjoy your mountains. He turns away and barks orders at his men. Secure the package. Get Volkov on the heavy lift. Prep the medical bay for immediate transfer. And clean up this mess. Leave no trace. The tactical operatives swarm the lobby. They move Volkov onto a specialized military stretcher, carefully protecting the improvised platinum shunt in his neck. They carry him out into the freezing morning air, toward the waiting helicopters. Garrick stops before he walks out the ruined doors. He turns and looks at me one last time. He gives a slow, deep nod of profound respect. Then, he disappears into the swirling snow. The operatives begin scrubbing the lobby. They use chemical solvents to dissolve the blood from the marble. They bag the ruined Persian rugs. They erase the evidence of the slaughterhouse with terrifying efficiency. I turn my back on them. I walk toward the corridor leading to the VIP wing. Dr. Julian Sterling and Vivienne Croft are standing near the entrance to the hallway. They are huddled together, shivering, their pristine world completely shattered. They look at me as I approach. Their eyes are wide with absolute primal terror. They are looking at a monster. I stop in front of them. I let my shoulders slump slightly. I lower my eyes to the floor. I let the coiled kinetic tension drain from my muscles. The apex predator retreats into the dark vault of my mind. The heavy invisible cloak of submission falls back over my shoulders. I look up at them through my eyelashes. Dr. Sterling, I say. My voice is soft. It is a submissive, timid whisper. It is the voice of Alara Thorne. Sterling flinches as if I have struck him again. Yes, he stammers. Yes, Alara. The detox ward needs its inventory checked, I say softly. We are low on glutathione bags. I will submit a requisition form to Miss Croft before the end of my shift. Vivian lets out a small, terrified whimper. She nods frantically. I give them a small, polite smile. It is a chilling, empty expression. I step around them and walk down the pristine, sound-dampened hallway. The morning sun reflects off the glacial ice outside, casting a cold, blue light into the corridor. My footsteps make no sound on the imported Italian marble. I am a quiet, unremarkable servant in a palace of glass. I am invisible again,